Thanks everyone for coming and spending their time with us tonight. Uh, the topic we're going to be talking about is actually something near and dear to my heart, as much as I have a broad array of interests. There's only so many hours in the day, and certainly enhanced recovery after surgery, surgical outcomes is passion and a really important part of my career and my interests in general. We're going to share screen here. I'll get you started on. Perfect. Thank you so much, Nikki, for starting with a land acknowledgement. Mine is very similar. We recognize that we work and live in the lands of Treaty 7, comprised of a number of different communities, and that I think we owe respect to the land. And personally, I take this land acknowledgement personally in that I always make my purpose of my day to make sure that every person who walks through the door of my clinic is welcomed and respected for their individuality and their background. Whenever I do a talk and whenever I take in a talk myself, I always think it's important to understand two things. Why should you listen to the person who's talking, and when should you take things with a grain of salt? And to that end, I think it's very important to be transparent with our disclosures. So one of the research projects that I'm undertaking at the moment is a randomized controlled trial that's being funded by two pharmaceutical companies that make intravenous iron, Pfizer Canada and Pharmacosmos. And so I'll show you the slide where we talk about iron replacement, but if there's any sort of bias there, it might be, that's something that could be there. Obviously, I do believe these products work, but we're trying to prove that. So as to why you should listen to me and why I've got some experience in this, I am a surgeon. Gynecologic oncology is a specialty that involves both surgery and provision and supervision of chemotherapy. A lot of my research throughout the years has been on improving surgical outcomes, and enhanced recovery after surgery is just that. The name is somewhat antiquated. It's a registered trademark from a society, but at the end of the day, enhanced recovery after surgery is not just after surgery, it's a number of interventions that make people's recovery go better. It's really a new way of thinking. It's always asking the question, why are we doing something? And if we don't have a good answer to that, how can we do better? It's a standard of always striving to be better. The enhanced recovery after surgery pathways that we're going to be talking about today are an amalgamation of that ideal. They're based on science. There are a number of elements and guidelines that help patients, providers, and their families navigate through the surgical process in a way that is better for the body, better for the mind than it was in the past over the last 200-300 years that humans have been doing somewhat organized surgery. A big part of enhanced recovery after surgery is exactly what we're doing today, and that's involving patients and their families in the recovery, making them active members of that process, giving people power back over their recovery as opposed to coming in and simply being at the trust and whims of the medical team, which are not perfect. And quite frankly, I think it's really important, and you'll see throughout this talk how important education and understanding are to someone's surgical journey. The core principles of enhanced recovery after surgery are preparing before the surgery, even before you come to the hospital, the time between when you meet your surgeon and you decide to have surgery with them to the day of the surgery. That's an opportunity for improvement. Other core principles are reducing the physical stress of an operation. And when I talk about stress here, there is also a psychological stress to this, certainly. But the physical stress, the fight or flight response, is something that we aim to minimize, because although that ideal is adaptive in some settings, it's actually quite harmful when you're trying to heal from a controlled surgical intervention. It's also involving a structured approach to hospital care after surgery. And this is where the guidelines come in. Make sure that people are being treated the same, no matter where they are in the country, no matter where they are in the world. they're treated with the same standard of care while still individualizing their care to themselves. And the other really core principle is getting moving after a surgery. And many people may have gone through surgery recently or many years ago. And many years ago, not that long, I suppose, laying in bed after surgery was a very common practice. And we'll talk a bit about why that wasn't necessarily the most helpful thing. Enhanced recovery after surgery has been used in multiple fields of surgery and medicine. Its specific use in cancer surgery is largely started off with bowel surgery, colon cancers, things along those lines, and that's the people who pioneered it at first. The listed guidelines that people work from are all on the Enhanced Recovery After Surgery website, and what I've listed on the screen here is a list of types of cancer that have specific guidelines for them. The teams here in Calgary are sort of world leaders in the gynecologic cancers, as well as bowel surgery, and the team doing breast cancer and reconstructive surgery actually have written several of these guidelines. So we're actively involved here in Calgary and in Alberta, but you can see that it's used across a wide array of surgeries that are part of someone's cancer journey. So why is all of this worth it? Well, as part of the continuous improvement that we do, we look at what it does for patients, and to make sure it doesn't do anything that we didn't expect that could be bad. What we know now, with thousands of studies and 20 to 30,000 patients having gone through these, that across the board, these type of guidelines, this mindset, reduces the complications of surgery, things like infections and having to go back into the operating room. It reduces visits to the emergency room and readmissions to the hospital. And anyone who's spent time in an emergency room can probably attest to how much nicer it is to not have to go there with the wait times. It reduces time in hospital. And that's important because the hospital is not always the most well placed to recover. It's an important place when you're sick. But when you're at home, you sleep better, because there's no alarms and there's no no person you're sharing the room with. There's better food at home, and you move more at home because you have to, and you're more comfortable doing it in your own environment. From a big picture standpoint, enhanced recovery after surgery also is important because it saves tax dollars. And as much as we never want to put price tag on things, we always want to make sure we have the resources in a public healthcare system to help everyone. And every dollar we save in one part of healthcare can then go to another part of healthcare, help someone else. When we talk today about what we're doing that is different than what was done before, it's easy to fall in a trap of superiority, to think, oh, we're better than they were. We're better than what they used to do. And any surgeon or group that's not doing this is potentially bad. That's in no way what I'm trying to get across. Every sort of procedure started somewhere, and everyone up until now is doing the best they can for the people they're taking care of. And so this is not meant to be a negative thing about any groups that are not doing this. They're still doing the best they can. Although we still try for improvement, it's important to have humility. And that's part of it, knowing that even 10 years ago, I did things that weren't necessarily recommended on these guidelines because we didn't know better. And at the end of the day, it's always about just trying to constantly improve. And I think that's the big takeaway. So take that all with a grain of salt as we talk about new things. We're going to go through a journey together. The journey of preparing for a surgery, at least a surgery that would be done under enhanced recovery after surgery principles. We're going to talk about before the operation, during the operation, and after the operation. And we're going to talk about different elements. So this can be a bit of a roadmap for someone who is expecting surgery in the future. Although your journey might differ slightly depending on the type of surgery you're having and certain elements of your own health that might necessitate tailoring of the protocol. This will be a general guideline roadmap to what would be someone's journey so that they can expect. And we'll talk a little bit more about why all of that is important and helpful. So before the operation, that moment starts the moment you speak to a surgeon and they talk to you about what the operation is. They will talk to you about what they're going to do, why they're going to do it, the alternatives, and risks and benefits. From that point on, you're in this before the operation time period, and this is where we can start making a difference. Right at that first interaction is one of the most important things that most important moments that we can step into, and that is in the form of education. Recommendations are that both written information, pamphlets, things like that, spoken information, physically talking to your team, and multimedia, things like websites, videos. And part of the reason why we're recording this today is so that we can use it with our patients going forward, so that they have a resource that they can go back to after that first visit. Other things that are really important with education are talking to your family, planning your stay, planning your ride home. These are things that can be very simple to organize, but actually can delay someone going home. And I apologize if you guys hear a little baby crying in the background. She's being taken care of. Planning for care if needed at home. Some people are quite concerned about going home after an operation because they think they're going to be less mobile, less capable than they were. So knowing what to expect after you go home, what you actually will be able to do, and planning accordingly, maybe pre-making meals or having someone make them for you, can really help the transition to home. Expectations about the surgery, specifically a range of how long you might be in hospital, can really make it easier to plan these things. People who are expecting to stay in hospital for a week, but then are invited to be discharged after 2 days, might be quite taken aback. And so expectations, knowing that things can change, are really important. How much pain you're going to have after the operation, what we use to treat the pain, really important to know going into it, what you can ask for, and also when to ask for nausea medication. Some people don't know that we have lots of options available for most of the symptoms that people have after an operation, but that they're on an as-needed basis. So if you don't ask for them, you don't get them. And so people unnecessarily sometimes suffer when they don't need to. All of this is important to teach the person undergoing the operation, but also their whole support network. And I shouldn't put family there. It's both family, friends, neighbors. Everyone is together and going a journey like this, and pooling resources can really help alleviate stress. As I mentioned, education is important because the fear of the unknown is really quite important. And if you know what to expect, it takes away that piece of the fear. There's still going to be fear involved with this. It's understandably quite a big part of someone's journey. But knowing what to expect, who's there to support you, what you can do for the things that you're concerned about, really can decrease the fear. We also know that this sort of intervention, this is proven that it both decreases pain, fatigue, fear, and these are all based on surveys and studies that we've done of patients undergoing these procedures. It also helps with that feeling of nausea because people know what to expect and how to treat it. Another thing that we can do before a surgery is take the time when you're waiting for that surgery and make you as healthy as you possibly can be. It shouldn't be a surprise that healthier people do better after surgery than people who are very sick. And we don't have to take that lying down, so to speak. We can get people moving. We can get people to work on themselves with help to get your body as healthy as it can be for surgery. There's a study out there that dictated that surgery, a major abdominal type of surgery, is the same demand on the body as running a marathon. And so you would never think about running a marathon without training for it. And surgery should be no different. We can always work to improve people's wellness and health before surgery. And that's a good way of taking advantage of some of the time that it takes to get people to surgery, whether that be a few weeks or a few months. That's time that can be well spent. So how else can we improve someone's health before surgery? Well, we can cut back on alcohol. We can cut back or ideally quit tobacco. We can exercise. We can focus on diets that are healthier. And that doesn't always mean Cutting back on your diet, it often means supplementing with protein, especially with patients who have other illnesses going on, like cancer. And identifying low red blood cell counts and anemia, which can really help with energy things. Cutting back on alcohol is important. Cutting back on smoking is even more important. Tobacco and smoking can really impair the immune system and your body's ability to heal. And so even cutting back a little bit on tobacco helps a lot. But in a perfect world, we'd have people stop 4 weeks prior to their surgery and ideally for their overall health, quit permanently. But you don't need to take something that arduous on all at once. This has been recommended for years. The difference that enhanced recovery after surgery protocols put forward is that we need to help people. And there are a lot of different ways to help someone cut back or quit smoking. Medications, nicotine replacement, and just counseling, and sometimes knowing that it's important is enough of a motivation and support for people to really cut back a little bit. Exercise. People can be pretty cautious about doing exercise both before and after surgery, especially when cancer is involved. But we've got robust evidence showing that exercise programs, usually when they're supervised and when you listen to your body, can really be well tolerated. They're not dangerous, and they significantly improve people's ability to move, their ability to walk a certain distance in a certain time, if you're measuring it scientifically, before and after surgery. So it makes sense. If your muscles are stronger before surgery and your heart is stronger before surgery, it'll be easier for you to bounce back after the challenge and the trauma that is surgery on the body. When it comes to diet, the first and most important thing that we've found when studying this is actually checking. No one ever really paid attention to it before. And so identifying nutrition in individuals, poor nutrition, is the first step in correcting it. And many people don't look malnourished when they might actually be. And so we have screening tools, we have blood tests that we do before surgeries, and they're part of these pathways to identify people who are at high risk of malnutrition and get them to the right people to help correct that. So registered dietitians are an absolutely essential part of my care team, and we send individuals there to help supplement their diets or assess further what's going on. As always, a well-balanced diet is important. We strongly emphasize protein, and sometimes when people can't take in a lot, we rely on things like protein drinks like Onshore or one of the other brands. Well, it makes a lot of sense that if your other health issues aren't under good control, they can have effects on your surgical recovery as well. That's where iron replacement comes in, and iron tablets, iron infusions, depending on your circumstance, can help replace iron levels, and that helps with your body's ability to spread oxygen through it and helps with your ability to heal. What that means is that you're better capable of dealing with these added stress of surgery because it will knock the wind out of your sails. Blood sugar control, extremely important. When blood sugar is not under good control for patients with diabetes, it can really impair their ability to heal and fight off infection. Blood pressure control, and really just making sure that any other medical issues are as in good of shape as they can be. And very often that involves the specialists in that area. Other doctors who admittedly know more about it than I do can see my patients in a sort of short fashion and optimize things. Sort of, I joke and call it crossing the T's, dotting the I's, and making sure that your healthcare is as good as it can be. Gut care for surgery is the last thing we're going to talk about before the operation itself. In the past, people had very commonly given people laxatives. And if anyone's had a CT scan or a bowel prep or a colonoscopy, you know what this is like, and it's very unpleasant. It's basically a way to clear out the colon. That can really dehydrate people. It used to be thought to decrease infections. Now we more talk about education, and so keeping a well-balanced high fiber diet, antibiotics to decrease the bad bacteria in the gut, and occasionally laxatives to help clear out the actual stool in the bowel for when surgery is going to involve doing bowel surgery itself. So we tend to avoid these more often than not now. There are some cases when this is indicated, but it's got to be very specific and evidence-based. As you can imagine, that leads to people being a lot happier before their surgery because they're not terribly dehydrated and they haven't been spending most of their time in the bathroom for the last 2 days. Just before a surgery, many people are familiar with the idea of nothing to eat or drink after midnight. The idea behind this was, again, well-meaning. It was meant to have people not have a full stomach at the time of their surgery, because when you go to sleep, there's a high risk that you could throw up any of those contents, and that could be quite problematic. That was based on experience from the 1800s. What it unfortunately has done is led many people, especially if your surgery is late in the day, to be quite dehydrated and quite hungry. And as you can imagine, you wouldn't run a marathon on an empty stomach. They're constantly having calories in their body. And the same goes for surgery. What we found is that the stomach actually empties in about 3 hours, 2 to 3 hours for liquids, and solid foods are out of the stomach in about six to 8 hours. There are some individuals where this doesn't apply, people with stomach motility issues. The stomach doesn't squeeze very well. But we've adapted our eating and drinking guidelines. And so anyone who's had surgery with our team or under an enhanced recovery after surgery protocol knows that clear fluids, anything you can see through, is safe to have up to 2 hours before your surgery. And in fact, we encourage people to have a big carbohydrate load, just like a marathon runner would, about 2 to 3 hours before the surgery. Still empties out of the stomach, but gives you that extra sugar, so your body is still in the mindset of healing, not starvation mode. This leads to less hunger for people, better surgical experience. And as anyone who has a morning coffee can say, you're really going to value having that coffee the morning of your surgery. You'll be a lot less grouchy. I know I am. Now, the only issue is you can't have milk with your coffee, but a black coffee or a black tea is better than nothing at all. Especially when you're waking up as early as some folks have to get into the hospital. So the actual day of the surgery, once you get to the hospital, we're going to talk about what you do, what the surgeon does, and what the anesthesia doctor does. The anesthesia doctor is the individual who puts people to sleep and manages their fluids during the operation. We joke that the surgeon's focused on the operation and the anesthesia doctor is focused on everything else about the patient. So things that the patient does, well, you still have to come to the hospital. I know many people don't want to see me that day, but it's very appreciated when you do come. Have a support person, a driver, especially if you're going to go home that day. And we're starting to do surgeries a lot more often, and we'll talk about that, where people can go home the very same day for surgery. And so something as simple as having a reliable person who can be there, because surgery can take a little bit of time or a little bit longer time, someone available to pick you up afterwards to drive you home, because you're not going to be in a state where you'll be able to drive. Other things patients have to do, they take medications as directed. Usually that means they're home medications, and those medicine doctors who saw them in advance usually give people pretty clear guidelines on that. And then we also give patients medications before the operation for both pain and nausea prevention. Sort of the idea of an ounce of prevention is worth a pound of cure. And so we always give people pills with a sip of water before their operation, just to prevent pain before it even happens. Now, things that your surgery team will do, even before they ever do any surgery, is that they'll often give blood thinners, because when you're laying there not moving for a couple hours for surgery, your blood tends to want to clot in the wrong areas. To give medications to prevent that, we also give leg massaging devices. They're not as nice as you would expect, but they do squeeze your legs, and that actually prevents blood clots from forming in the wrong parts of your body. Rest assured that people still form blood clots to prevent themselves from bleeding from surgery just fine. We give antibiotics before making our incisions, and that's to decrease the normal bacteria on your skin that we don't want inside the body. And we also clean the skin before the surgery using sort of alcohol-based cleaners. Sometimes we also have people do that the night before and just before surgery, sort of a 1-2 punch for the bacteria, just so they don't go where they're not supposed to. Now, things that the anesthesia team does, this is a big change that's happened, and it's been a part of the collaboration that Enhanced Recovery After Surgery strives for. And that is that they give you fewer drugs that make you drowsy before an operation. They used to very commonly give people anti-anxiety medications with the thought that they'd fall asleep better, but it also means that they were very drowsy waking up from surgery. We use anesthesia medications that wear off quickly, but work really well when we need them, so that when you're giving them consistently to a person during an operation, they work beautifully. But then as soon as the operation is done, they're gone. People are waking up, breathing on their own, and getting ready to move. And as we mentioned, the anesthesia doctors also give additional medications to stop nausea and vomiting, even before people go to sleep. Goals during the surgery for the whole team are to avoid unnecessary tubes. If it's going into a person's body, it needs to have a purpose. And that seems like common sense, but it's taken us about 100 years to figure that out. Another goal is to keep people warm, which again, seems like common sense, but operating rooms tend to be very cold, and it's easy for someone to become their internal body temperature to get very cold when they're not moving around and shivering to make that energy for themselves. So we want to keep the person warm because everything in the body works better when it's at the temperature it's meant to be at. And the other goal is that if you're sleeping and we want to give you fluid back for any blood loss or your normal fluid production, making pee, we want to give you just the right amount of hydration. In the past, they used to give people lots and lots of fluid, and they would end up kind of puffy like the Michelin Man. And we now know that that's not the best idea. So a lot of these things seem like common sense, but if you didn't sit down and think about it, people can do what they think is the right idea, well-meaning again, while inadvertently making people's outcomes not so good. On the same note, surgery, as we mentioned, is important, but it is a trauma to the body. So one of the major aspects of enhanced recovery after surgery is to do something very simple, like the least harmful surgery possible. And so if you have to do surgery inside someone's abdomen, in the past, the only option we had was to make a very big incision. And that was hard to recover from. But with new technology, things like robots and laparoscopy, meaning we've got a camera that goes in and tiny little instruments that do all the work, that we manipulate to do all the work for us, we don't have to make one big incision. We can make a number of tiny little incisions. Usually the biggest size we'll do is about 1 centimeter, sometimes 5 millimeters. And the small incisions in a bunch of different spots end up being a lot better for people than one big incision. Less infection, less bleeding, faster recovery. And this has enabled us to do surgeries for people where they can go home before I do in the day. You know, they go home 6 hours after their surgery, when before this technology came along, a big incision, they would stay at least 6 days. And we know that going home is extremely safe. People have the same or better outcomes than if they stayed in hospital. There's nothing magical in the air in hospital. In fact, there's lots of nasty things floating in the air in some parts of the hospital. And so getting people home is better. We've recently introduced this across a lot of different surgeries that we do. And we have found that about 80% of people can go home from these operations the same day, and they do better than if they stayed in hospital. Same surgery with the small incisions, just going home that day. So we've gone through all of that work. People wake up after the surgery, the family's been called, and now what do we do to continue this improvement that we've been working so hard on? Well, once again, you're not going to be moving as much as you were before the operation. And surgery itself says to the body, oh my gosh, something's cut me. I need to clot so I don't bleed. It's an adaptive response if you're running from a tiger and being attacked. It is not an adaptive response if you're having very controlled surgery where we don't leave you bleeding. And so we continue this process of giving blood thinners to prevent blood clots in the wrong area, and leg massaging devices until you're up and walking to prevent blood clots in the wrong area once again. Sometimes that risk of blood clots is high enough that we actually send people home on blood thinners for an entire month as their body starts healing and realizes that stress is no longer there. And so that's very common and becoming more common with cancer surgeries, because cancer itself is a stimulus to the body to clot. So especially important in this population. An apple a day keeps the doctor away, and eating and drinking after surgery does a very similar thing. We get people drinking immediately after their surgery. We give them food within the first day, as long as they're tolerating it. And what I say to my patients is that if something looks good, smells good, and you're hungry, eat it. if you feel nauseous or you don't want to eat it, you don't eat it. And I very specifically put the picture of this hospital food on the screen here, because does that look appetizing? Heck no. One of the reasons why it's better to be at home, but I often encourage my patients to bring food in from home, something that's better tasting, homemade comfort food, something that reminds them of their own culture sometimes. And so we do recommend that. We often supplement people's diets with those high protein drinks. So if they're only keeping a little bit down, then they get some protein. But it's really important for both your body and your bowel to get food. We also don't flood people with fluids anymore. We stop the intravenous, the IV fluids going to their arms as soon as they can drink. It's better to absorb fluid through your stomach than through your veins. It makes a lot of sense when you say it this way, but it is just better for the whole body. About 80% of that fluid that's hanging in a bag goes where we don't want it. It goes in people's legs, it goes in people's lungs. And if you drink the fluid, it stays more in your veins, okay? This is a big change, and not every surgery is this okay for, but the vast majority of the time, even when bowel surgery is done, this has been proven to be safe and actually safer than having people starve. And so you're going to see this more and more often. Again, part of this is educating people, because we don't want people to eat things and then throw them back up. If you're feeling nauseous, sick, ask for nausea medications, but don't force feed yourself. And what we do is we actually schedule people's anti-nausea medications so they don't have to ask for them. We give at least one of them every so many hours just to prevent nausea. Again, an ounce of prevention is worth a pound of cure, to let people get those calories in their body, because again, you need to recover, you need building blocks to recover. So we mentioned the gut. The number one thing that causes people pain after an operation that I do is gas pain. The gut goes on strike and you get gassy. And gassy pain is really unpleasant, and it's even more unpleasant when you've had an incision in your abdomen. The gut, I like to describe as a unionized employee. If it doesn't like its working conditions, if it's being roughed up, moved around, it goes on strike. And that's what happens with the surgery, is there's things happening in its working condition, which is inside the tummy. It gets pushed out of the way so that surgery can be done. And that means it goes on strike. And so what we do for that is improve the working conditions. One, be gentle with the bowel and the gut. Prevent things that make it angry, like infections. And then what we do is we gently remind the gut that it has a job to be done. And what we do is feed people. And so every time you drink something or eat something, it sends a signal to the gut, which has as many nerves as the brain does and is a very complex organ that has to coordinate its function. Every time you send a signal that says, hey, I know you've had a rough day, but you've got work to do. Could you maybe start moving again? And sometimes people can't eat or drink, they're feeling nauseous, but we trick the gut, because even chewing gum tricks the body into thinking that you're eating. When you chew, it sends a signal to your gut, says, get ready, we got some work to do. And doing those things helps get the gut moving faster. And it gets that gas pain down faster as soon as people start passing wind. So we always joke that we get excited when people fart, and we're not weirdos, we just care about our patients. And so getting the gut moving has a whole trickle-down effect of reducing pain, allowing people to move more, and you build off the victory. Another thing that helps the gut move, and we don't exactly know why this is, but walking, moving, helps get the blood flowing, and that gets the bowel going faster too. And brings me to movement. As we mentioned, this is a core principle of enhanced recovery after surgery, and that's to get moving as soon as you can after a surgery. So in the past, people were in bed not moving because there was a fear that they would damage their incision, that things would break open. Rest assured that we do a very thorough job of closing people and making sure that stitches are strong and everyone's put back together in a sturdy way. Almost always, when those stitches break down, it's because something bad is happening to the person. It's not a failure of the material that we're using to put people together. It's a failure of an infection damaging the tissue around it, so things break down. So there's no harm in getting up and walking, getting up and moving. That's not going to cause a problem. And in fact, it prevents a lot of problems. And so instead of staying in bed like a porcelain doll, you get up and move with supervision. We will have people sitting at the side of their bed the day of their surgery. We have every person walking within a day, at least a couple steps up to the bathroom, ideally up several times a day. And the most important thing of this is that it gets the blood flowing, which decreases those blood clots. Improves the gut motility, and that reduces the gas pain. It improves people's breathing, and they can breathe deeper when they walk, and it prevents muscle wasting. Laying in bed for 24 hours can cause muscle wasting and weakness of the legs that can last weeks to recover from. So again, preventing a problem before it happens is much better than trying to play catch up. Tubes. Leaving fewer tubes in the body is a good thing. People used to put tubes into the abdomen to drain any bad things out. Those actually just let bad things in. And so we avoid drainage tubes, both in the abdomen, in the nose, in the bladder, the catheter, for the shortest period of time possible. These are foreign bodies. They provide a route for bacteria to get in. They're not comfortable. They prevent people from moving. And it seems like common sense when I'm talking to people, but it took a long time to realize that these tubes, which we thought were helping people, were actually not. And so the faster we can get tubes out, the better, as long as they're not needed. Again, if they're needed, they stay in, but getting them out, very important. Finally, I realize that what I do is cause pain to people on a very regular basis. We try to minimize that, but surgery is going to cause pain. So understanding that pain, understanding how to treat it and why it happens is really important for both people's recovery, to avoid using more medications than they need, to prevent them from suffering. We never want that. But also to help with mental well-being, because pain at its core tells us something is wrong. And if you don't understand why it's happening, your mind's going to go to the darkest places, especially when you've been through a scary operation. So what we found with controlling people's pain after an operation is that a little dash of everything, a bunch of different things, is better than a whole pound of one thing. So think about a good recipe. You're going to put in a little bit of basil, a little bit of oregano, a little bit of thyme, and a little bit of salt, rather than just dumping a bag of salt into it. And that's what used to be done with narcotics. Narcotics being things like morphine, hydromorph, all those opioids that we hear about. Those used to be given like candy, and they are still given like candy many places in the world when they don't need to be, because they don't work very well. They have pretty big side effects. Most specifically, they slow down your bowel, which causes more pain. But rarely they can also cause addiction. And even if it's rare, that's a life that's ruined, and that's not what we're in this business for. So what I usually recommend is a little bit of everything, and keeping a steady dose in the body to prevent the pain before it happens. So we started with pain medication before the operation. We give plain old Tylenol, plain old ibuprofen around the clock every 6 hours, and that actually prevents inflammation and prevents pain before it becomes significant. At the time of the operation, we often give injections of freezing drugs to block the nerves. And the biggest form of this is something called an epidural, like you would see in someone who's giving labor, a lot less oomphy, just enough to control pain. People can still walk, they can still pee, and that works to block pain at its source. Now, don't get me wrong, we give opioids, but only when we need them, and we only give the smallest amount needed for the shortest period of time. So there's this pendulum swing where people say, well, I'm not going to give any narcotics. Well, that's silly. We don't want people to suffer. And we know that preventing pain and treating it early on prevents it from ramping up. And so if you give a little bit of all the pain medication early, you'll give a lot less later, because the body knows if there's pain, it's going to expect more pain. And so keeping on top of it, prevention more than cure. Another piece about the pain medication, a lot of the times in the past, we were using pain pumps. Those can be quite good, but you can't use them when you're asleep. And so you often fall behind in that pain cycle. And so we often get our nurses to give the medications. They're very dedicated, they're very hardworking, and they work nights when you sleep. And so they can give people medications before it becomes a problem. This is a pyramid of how we control pain. And I added this circle actually not that long ago because it's more than just starting with local freezing and then adding acetaminophen, adding ibuprofen, and then using opioids only at the top. Pain is not just a physical stimulation. It is an experience. There's pain, there's suffering. It's ultimately felt in the brain. And so when you feel pain after an operation, you don't know if that's normal pain or danger pain, and you need to be worried. And now your body's going to get ramped up about that. So part of this whole process is your team hearing you, listening to your pain, asking you those questions about where it is, how often it is, and doing an investigation. That investigation might be something as simple as just laying a hand on the tummy and seeing where the pain is. It might be something like a CT scan, but that provides an understanding of what's causing the pain. And if you know that the pain has now been found out to be normal gas pain after an operation and it's not dangerous, then that can provide reassurance. And when people know that the pain is not dangerous, that they are still safe, their experience of pain goes down. They tolerate it better. And that's really important. It doesn't mean that the pain wasn't real. What it means is your experience is more important than a number on a scale. Another important piece to all of this, and part of the education that starts from the start, is that surgery does cause some discomfort. And the goal is not to have zero pain. It's impossible to do. And the only way to have zero pain after an operation is to have so many medications that you are basically passed out. It is okay to have a little bit of discomfort. When you move, your muscles are going to be sore. What we say is we don't want the pain to be intolerable. We don't want you to suffer, but we don't want it to get in the way of you doing the things like walking that are going to get you to feel better. And so that's the goal, is to get the pain controlled enough that you can still live and improve and heal. Getting it down to zero, not going to be feasible, and actually is going to get in the way of the other things that are going to get you better faster. Now, we have all these things that can make the hospital stay more efficient. Best yet, don't stay in the hospital at all. We talked about the minimally invasive surgery. And again, instead of one big incision, multiple small incisions, less pain, less infection, can go home from hospital the same day. And as we become better with surgical techniques, but also with home monitoring and things like that, we are able to send more and more people home the same day from their operations and yield and get these benefits of being at home in your safe space. So you'll see that more and more often. And this doesn't have to be anything fancy with robots. This can be plain equipment, but the robots do help facilitate it sometimes. So we've gone through a bunch of things. You've been maybe scribbling notes furiously about what to do. It's important to know that guidelines are just that. They are meant to be a starting point. They're not a one-size-fits-all system. People are individuals. We talk about individualized healthcare, precision healthcare all the time. It's important to recognize that not every single element is appropriate for every single person going through surgery. And that's okay, because at the end of the day, we want to do what's best and science-based for everyone. Perfect example of this, and things that I teach to my trainees and teach to physicians who are learning about enhanced recovery after surgery, are things like diabetes, which is sugar control. When people have had diabetes for a long period of time, sometimes their stomach doesn't empty as fast. And so those rules about fasting, the rules about not eating or drinking at certain times, change. Do we want to give a really sugary, high protein drink to that person? No, it's going to throw their sugars off. And there are other things that we do to optimize and improve their care. Some bladder surgeries might need a catheter in for longer. Can't take it out right away. That does still need to heal. And some pain medications aren't for everyone. Ibuprofen or plain Advil can be very dangerous for some individuals. It can be a little bit dangerous for others, and you have to be very careful with it. So people with uncontrolled acid reflux or people with kidney damage, it can be hard on their body. And so you either don't use it or you use it sparingly and very carefully. And then overall, people who are very sick before their surgery or very sick after their surgery may not meet any of these criteria and might need to go to somewhere like the intensive care unit temporarily, where they have their own set of guidelines for things like this. So It's all meant to say that we are still learning, and eventually we're going to have tailored guidelines for every single person, but that's probably not going to be for some time. We do put these modifications in all of our educational pieces and our guidelines, but there's going to be some element of the patient interacting with the medical team where they come up with their own individualized care plan for someone. Perfect example being days like today, well, maybe not today, but when days when you get a lot of snow, someone's not going to be able to go home that same day because the roads are terrible and we don't want them to get in a car crash on the way to Red Deer. So kind of defeats the purpose. Finally, we talked a little bit about the differences by patient, differences for different surgery. Again, surgery on the colon and surgery on the bladder are going to be very different things that need different guidelines. And so that's why on the Enhanced Recovery After Surgery website, there are specific recommendations for every one of those different surgical types. And these are all made by people in that field. So Dr. Nelson, who's a colleague of mine, and myself, we worked on the guidelines for gynecologic oncology across the world. Dr. Temple Oberly, who's a plastic surgeon who does breast surgery, made the guidelines for breast reconstructive surgery here in Alberta, and then have disseminated that across the world. It's all based on the best science and continues to strive. And whenever there's a gap where we don't understand what we should do in that circumstance, that prompts us to do more science. And that's partially why I'm doing a lot of studies that I'm doing, is to make sure that we fill that knowledge gap so we can provide the best guidelines across the globe. The one thing I didn't mention is that ERAS guidelines might differ by place in the world as well. Some places in developing countries can't do all of the same things that we can provide here for various reasons that we don't quite understand until we talk to them. And so we're working with a bunch of very keen researchers in South Africa right now to work on guidelines for South Africa and the communities around there to see what works for them, because again, one size doesn't fit all. So I've been talking for quite some time there. Have a sip of water, but ultimately you've gone through all this. What is enhanced recovery after surgery? It is medical professionals working with patients and other providers trying to do better at every step of the way because at the end of the day, what matters to us is our patients. And nothing makes me feel better than someone coming back to my clinic saying, I had no pain after my surgery. I couldn't believe how well that went. Or, it was exactly what I expected. And so we always want to be doing better. It's just part of our type A personalities, I suppose. One of the things that's really important is that to make sure that we are doing better is to look. You don't know if you're doing something well unless you're checking. And this is a big element of enhanced recovery after surgery that we push because it's kind of annoying to do. You don't just implement the protocols, you implement them and then make sure that what you're doing made a difference and is going well and that it's not having unintended consequences. And so that's what an audit is. We regularly, every year or two, we look at every patient who's had surgery at our center in gynecologic oncology, and we make sure that their outcomes are good, and we compare them to the last set and the last set to make sure that things are always getting better, always improving. And that allows us to change these guidelines. We've done 3 forms of the guidelines in the last 7 years, and things are always changing as we know more, as we have more options available. And part of the things we're looking at now is patient satisfaction. And we're always going to be changing things, hopefully for the better, but always checking to make sure so that we can always take a step back and say, what happened there? Can we do better? So that's your quick and somewhat quick introduction to enhanced recovery after surgery for cancer surgeries.